There we go. All set. Good morning, everyone. My name is Dr. Chudley Wirch. I'm president at Prevention Plus Wellness, located here in beautiful Jacksonville, Florida. Thanks for joining us for today's session. This training session will last about an hour. And so, of course, the topic, as you can see, practical evidence-based substance use prevention, an introduction to Prevention Plus Wellness program. So this session is being recorded. I will send everyone everyone who's registered for this session, a link to the recorded session in case you are pulled away or you missed this for an emergency or work or whatever the case might be. You'll still be able to view this session. I think it's a good one, jam-packed with a lot of good information. And you're welcome to share the link with others in your region, your state, and your nation. And I appreciate all of you being here today from across the country. We have people from across the United States, and I think even abroad, quite a bit of interest in this topic. And so it's always a pleasure and honor for me to spend time with those of you prevention specialists and health care providers that make a difference in your communities with your young people, your youth, your young adults, your families in your communities. And so thank you for the honor to spend this time. And I am hopeful that some of this information will be of use to you. If not, you can let me know because I'll be sending you a link after today's session where you'll be able to give me some evaluation feedback. So at the end of today, for those of you that are with us live, I will also be sending you a CEU certificate for 1 hour for your time spent with us today. So let's jump right into it because we've got a lot to cover during this hour, and that hour will be, give or take 5 or 10 minutes. And afterwards, I'm happy to stay and answer any questions you might have. So as we go along, if there is something that pops into your mind, a question, a comment, feel free to jot it down here in the chat link or make note, and you could send it to me at the end of today's session. So there's 4 objectives for today's training. The first is for you all to examine evidence-based and evidence-informed substance use prevention plus wellness screening and brief interventions. That's the first part, so we'll introduce what we have to offer here at Prevention Plus Wellness, LLC. Secondly, is to list differences between typical substance use prevention and Prevention Plus Wellness programs, which are uniquely differential in a number of ways. You'll be able to see that today. Number 3, you should be able to explore, and we will together do this, explore the theory as well as research supporting brief and multi-health risk behavior interventions, both brief interventions as well as multi-health interventions, as well as Prevention Plus Wellness interventions, which are actually brief multi-health interventions. And then lastly, describe options, settings, steps, and adaptations for implementing and evaluating Prevention Plus Wellness programs. So you can see really a broad range of topics and content we'll be covering today. Let's start with Prevention Plus Wellness programs and components just to get everybody on the same page. I know we have people that are being first introduced to Prevention Plus Wellness programs, others that may have implemented them. So trying to get everybody the same basic understanding. Under the heading of evidence-based Prevention Plus Wellness programs, our sport program has been proven through rigorous controlled trials shown to prevent alcohol, tobacco, and cannabis use, as well as increase physical activity among non-using and substance-using youth. The Sport Prevention Plus Wellness, or PPW program, targets physical activity, healthy nutrition and sleep, and to a lesser extent, stress control. The Sport PPW program is a single session, unique single session program, less than 50 minutes in length, screening and brief intervention format, and we have versions for high school, middle school, and elementary school. The Sport Prevention Plus Wellness program is typically implemented with slides, PowerPoint slides, and it comes in, your manual comes in a script to provide it either individually, one-on-one to young people, or in a group setting, so you have that flexibility. The Sport Prevention Plus Wellness program, as all of our PPW programs, are based on a marketing-related theory emphasizing positive images, and I'll be describing more of that later today. The Sport PPW program has optional parent materials, particularly a letter to parents and 4 weekly flyers, and those could be mailed out, emailed, sent out, put on your website. And those are just optional intervention, actually an optional intervention in your program manual. And all of your materials with the Sport PPW program come with, in addition to the manual, physical manual, reproducible materials in a digital download. So you can make copies and implement your Sport PPW program to countless young people. Dozens, hundreds, thousands, millions if you want to. And the beauty is, because it's a single session, you can reach youth that cannot be reached with other more intensive or lengthier prevention interventions. Our parallel program to Sport is the InShape Prevention Plus Wellness program, where Sport is for youth, InShape is for college students and other young adults. Like Sport, InShape is evidence-based, has been proven to prevent alcohol and cannabis, as well as heavy drinking and heavy cannabis use, as well as drinking and driving, while increasing physical activity, sleep, and health-related quality of life among young adults. The InShape PPW program targets, like Sport, physical activity, healthy eating, sleep, and a little bit more content on stress control. It is a single session screening and brief intervention, less than 60 minutes in length, and it's implemented with PowerPoint slides. And again, your manual has a scripted or protocol in it to provide this brief intervention either individually to youth, young adults, or in a group setting. Also, InShape, like Sport PPW, is based on a marketing theory that emphasizes positive future desired images and peer images, which I'll describe in a moment, and comes with reproducible materials through a digital download. So you could implement, you have the manual, and you could get some online training if you would like, and you're ready to go and implement this to many, many young people in your setting, in your community. Prevention Plus Wellness also offers a number of evidence-informed programs. We have a program addressing vaping, e-cigarettes, vaping. That's Vaping Prevention Plus Wellness, Marijuana Prevention Plus Wellness, Opioid Prevention Plus Wellness, various versions of these programs for high school, middle school, in some cases even adults. We have a Sport 2 Prevention Plus Wellness program, which is our only multi-session intervention, and In God's Image, which happens to be a faith-based screening and brief intervention. All of these evidence-informed programs are based on the what would be called an evidence-based screening and brief intervention practice, and are adaptations of either the Sport or InShape Prevention Plus Wellness program. These programs, like the evidence-based Sport and InShape program, targets physical activity, healthy eating, sleep, stress control, and In God's Image also addresses spirituality. These programs are single session with the exception of Sport 2, which is 6 sessions. They are implemented with PowerPoint slides. They can be provided for the most part either individually or in a group, based on this marketing theory focusing on positive image communication, and again come with a digital download so you can provide them to countless young people. Now, substance use prevention, let's take a look at it in relation to, compare it and contrast it to Prevention Plus Wellness interventions. So in the left-hand column, you see typical prevention programs, right-hand column, Prevention Plus Wellness programs. So if you look in the left-hand column, number 1, typical prevention programs address one or more substance-using behaviors. And if you shift over to the right-hand column, you see that Prevention Plus Wellness programs address substance use as well as CDR behaviors. And CDR behaviors are chronic disease risk behaviors. In particular, sedentary lifestyle or physical inactivity, poor nutrition, inadequate sleep, and uncontrolled stress. So these are what's addressed in Prevention Plus Wellness program: substance use and CDR behaviors. Go back to number 2 in the left-hand column. Typical prevention programs address include, I should say, multiple sessions, sometimes 6, 10, 15, or more sessions implemented over a period of months or even years, whereas number 2 under Prevention Plus Wellness, as I've already mentioned, the majority of our Prevention Plus Wellness programs are just a single session, brief, practical, and yet very powerful, which I'll highlight today. Number 3 under the heading of typical prevention programs, educational in nature, whereas number 3, the Prevention Plus Wellness programs are more motivational than educational. There is some education, there is some information about how substance use interferes with the wellness promoting behaviors, but the real emphasis is on, because it's a screening and brief intervention, is motivating change, getting young people motivated to change their behaviors. That includes avoiding substance use and improving one or more protective wellness behaviors by getting them to begin the self-control, self-regulation process through goal setting. Lastly, in the left-hand column, typical prevention programs address substance use risks and resistance skills, whereas number 4 on the right-hand column, Prevention Plus Wellness programs also addresses substance use risks. It's a little bit more narrow, I believe, but also self-control skills and desired future and peer images, which I'll highlight more of. In addition, unique aspects of Prevention Plus Wellness programs include number 5, that they promote habits improving mental and physical health, not just the avoidance of substance use, which is in itself tremendously critical for young people. Prevention Plus Wellness programs are include multi-behavior or multi-health behavior goal setting, as I mentioned earlier. Number 7, they include scripted content which increases their fidelity and replicability across implementers and settings and time. Number 8, PPW programs are easy to implement and can be tailored. Number 9, they have optional implementation methods, as I've already mentioned, either individually, one-on-one with young people, or in group setting. And then lastly, they include built-in immediate pre-post scannable surveys and free program analysis. So let's take a look more specifically about some of these issues that were raised about the differences with Prevention Plus Wellness programs. Let's take a look at the fact that Prevention Plus Wellness programs address substance use and CDR, or chronic disease risk behaviors. So what we're comparing here are the evidence-based sport Prevention Plus Wellness program for youth in the left-hand column, and the right-hand column, InShape Prevention Plus Wellness program for young adults. And as you can see, both of these programs address physical activity. Sport also addresses sports. The sport program also addresses environmental influences, particularly peers and friends, as well as healthy breakfast and nutrition, sleep 8 or more hours, alcohol or other drug use, and relaxation strategies. So the sport program, and of course its adaptations, address other substances other than alcohol. So for example, the Marijuana Prevention Plus Wellness program addresses marijuana and other drug use. Vaping addresses e-cigarettes and other drug use, and so forth. InShape, a little bit different, but more similar than different, addresses moderate as well as vigorous exercise, so it differentiates among those two types of physical activity. Healthy nutrition, sleeping 8 or more hours, more emphasis on stress control techniques, and addresses binge drinking, tobacco, and other drug use. So you can see how Prevention Plus Wellness programs are multi-health behavior. They are, as I mentioned, also single session motivational screening and brief interventions, or SBI, screening brief interventions, one-time sessions. Screening brief interventions, more motivational than educational, and they're based on the behavior image model. That's the conceptual model that we'll be talking more about, BIM, the behavior image model. But before that, I'd like to say that the practice model, the actual format for interventions for the majority of our Prevention Plus Wellness programs is the screening and brief intervention, SBI, which SAMHSA, Substance Abuse Mental Health Services Administration, and a number of other organizations have emphasized as being evidence-based practices. So in our case, Prevention Plus Wellness programs include 3 steps. First step is to screen participants for their current health habits. That includes not just substance use, but these other wellness habits, or if you will, if you look at the other side of that coin, the chronic disease risk habits like physical activity or not. Then after that, providing feedback to young people with regard to, and providing, by the way, positive image messages using the script in your manual and the PowerPoint slides. We also have booklet options for some of our programs. And then thirdly, assist participants to set and monitor goals to avoid substance use and improve one or more protective wellness behaviors. So those are the steps for implementation in the screening and brief interventions called Prevention Plus Wellness programs. Screen for current health habits, provide feedback, and trigger these positive desired images of themselves, engage in wellness behaviors and how substance use interferes with that. And then once those young people are motivated to change, take advantage of that, capitalize on that, those images as values, and they can decide what are their values and decide if they want to set goals to move themselves forward and improve their lifestyle and their overall physical, mental health, and personal development. So let's take a look at the evidence supporting screening and brief interventions, because Prevention Plus Wellness programs are screening and brief interventions, are a specific kind. Let's take a look overall at evidence associated with the effectiveness of SBI. So if you look at the left-hand column, there was a review of research which showed that screening and brief interventions were effective for up to a year after receipt with adolescents and young adults. That was a review of research studies done back in 2015. And in the right-hand block, you can see that we've conducted a number of studies showing Prevention Plus Wellness screening and brief interventions have been effective. And again, even a year after a single session, we have a couple of studies or several studies supporting that. More support for screening and brief interventions as evidence-based practice in general. As I mentioned earlier, SAMHSA has identified screening and brief intervention as an evidence-based practice. This includes SAMHSA's screening, brief intervention, and referral to treatment, or SBIRT or SPIRT. As well, Centers for Disease Control supports alcohol screening and brief interventions in primary care, including pediatrics offices for young people. And the World Health Organization supports alcohol screening and brief intervention as a practice because of the wealth of supporting research. Continuing along, the National Institute of Alcohol Abuse and Alcoholism supports alcohol screening brief intervention for youth. The American Academy of Pediatrics supports substance use SBIRT for young people. And lastly, the National Institute on Drug Abuse supports adolescent substance use screening for screening and brief intervention. So lots of support for screening and brief intervention in general, particularly related to substance use and young people. Now, how about the evidence supporting Prevention Plus Wellness screening and brief intervention? So drilling down a little bit, looking more specifically at the Prevention Plus Wellness programs, let's take a look at, first of all, the Sport Prevention Plus Wellness program and the peer-refereed published research in these well-known scientific journals. And to summarize across all the studies that have been conducted, you can see these are sort of a summary or sort of a thumbnail of all the effects. I'll go down the list with you. The single session Sport PBW program has been shown to significantly decrease alcohol use, initiation, quantity, frequency, binge drinking, as well as alcohol problems, while significantly increasing physical activity among participating adolescents, reducing cigarette smoking with some effects even a year later after that one session intervention. along with reduced binge drinking, smoking, marijuana use, and increased physical activity among drug-using youth. And again, even a year later, increased parent-youth communication. The parent flyers alone in a separate study were shown to reduce alcohol use, problems in marijuana use, and increase parent communication. And lastly, in a translation of sport into Turkish language, there was a study that showed that the sport program increased indices of physical activity, nutrition, sleep, and mental health compared to youth that didn't receive the sport program in Istanbul, Turkey. Then we have a host of qualitative feedback. And by the way, this quantitative and qualitative data are presented on our website, preventionpluswellness.com, and you can learn more by going there and reading all about it. So, but I think it's very telling to listen to and to use the actual words written by young people themselves who have participated in sport and In Shape and our other Prevention Plus Wellness programs. So for example, this is feedback from some high school youth, I think across 4 high schools in California, not too long ago, about a year or 2 ago. And these are some of the comments they said. I liked how it told us about what drugs and alcohol, can affect your life. And I think that says friendships, my little images in the way. And friends, I like the fact that it lets you set your own fitness goals to help you stay fit. I like that it tells you what you should and can do to actually eat healthy and eat breakfast and do exercise, knowing that I don't have to be skinny to be healthy. Sort of a body image issue, very important. That'll change my mindset. In other words, motivate me to live a healthy lifestyle, and that it was fun. So lots of positive feedback in different areas, different health behaviors, motivation, goal setting, and that they enjoyed it. And here are the published papers that are cited on our website. Then we can take a look as well, and you could explore, if you like, the peer-reviewed published research supporting the evidence-based In Shape Prevention Plus Wellness program. These papers are published in these 4 refereed scientific journals. And again, summarizing across all those studies, the single session In Shape Prevention Plus Wellness intervention was shown to significantly reduce frequency and heavy use of alcohol, reduce drinking and driving even a year later after that single session, reduce initiation quantity and heavy use of marijuana among young people, increase sleep, exercise, and healthy nutrition, increase social and spiritual health-related quality of life, which is important, and improve body image satisfaction. And these are the papers that report those effects. Now that these programs are research-based, and because they are research-based, they have also been added to a whole number of evidence-based registries. And so here's just a few of them from Blueprints for Healthy Youth Development, which is having their biannual conference in April in Colorado. If you haven't looked at Blueprints for Healthy Youth Development, they're more restrictive and higher standards for access for being on their registry. But take a look at them. They have both the Sport and In Shape Prevention Plus Wellness program. Results First Clearinghouse, the original federal database, NREP, or National Registry of Evidence-Based Programs and Practices, has been frozen, but Sport and In Shape are still listed on those. Clearinghouse for Military Family Readiness, Promising Practices Network, Child Trends, Prevention Matters. I like Washington State Institute for Public Policy because it has cost-benefit analysis showing that Sport and In Shape are very, you get very much benefits for a very low cost. And a whole number of other national and state registries list Sport and In Shape. Prevention Plus Wellness targets substance use risks and self-control skills, a little bit different than typical prevention programs. And that's because Prevention Plus Wellness programs are founded on the behavior image model. This is the conceptual framework for PPW programs. The BIM, the behavior image model, is a marketing-related conceptual roadmap, and anybody could use it. It's published, and you can look at it, and we do webinars regularly on how to apply it to create your own messaging, campaigns, programs. In fact, we just did one, I think it was last week, on cannabis vaping use messages. So you can use the behavior image model to develop brief programs or communications that connect the promotion of wellness with the prevention of substance use. Now, there's two components to this particular model. The first is that the assumption that you can use positive images, cue them or trigger them very quickly and easily, and this will increase motivation for changing young people's lifestyles and behaviors, specifically both substance use as well as wellness promoting behaviors. And then secondly, that using multiple behavior goal setting will increase self-control, and self-control, self-regulation skills, very, very important for young people to prevent substance use, but also to improve themselves physically, mentally, and in other ways of their life. So self-control, self-regulation skills, very important part of Prevention Plus Wellness programs. But to focus a little bit more yet on substance use risks that are addressed in Prevention Plus Wellness programs, the majority of the content addresses substance use as a barrier to each of the targeted health behaviors. So alcohol or marijuana or e-cigarettes or opioids or whatever the case may be, as a barrier to achieving, engaging in, increasing, improving physical activity, playing sports, eating healthy, getting sleep, controlling stress, and achieving those positive benefits, including how they feel and see themselves. And other substance use risks that are addressed in Prevention Plus Wellness programs is how substance use harms your fitness and health overall, causes life problems, the myths associated with them, that most youth do not use these substances, a social norms message, healthy alternatives, choosing for yourself, planning ahead, trying to get young people to make those decisions before being in that setting where they're offered, and summary of a risk, so summary of all the risks. So just to give you a couple of quick examples of content from slides, this one shows how substance use interferes with physical activity, active life, and alcohol. Do not mix. Alcohol and drugs hurt your relationships, how well you do in sports, how well you feel about yourself, your energy level, and how you do in work and school. Here's another example related to sleep, how alcohol, tobacco, and drugs can disrupt sound sleep, stop deep sleep patterns needed to maintain an active and high energy life. So see how we link particular substance use or substance use behaviors and how they interfere with a whole range of wellness promoting habits and positive images associated with those behaviors. And as I mentioned earlier, Prevention Plus Wellness, in addition to addressing those positive images, address self-control skills, particularly self-regulation skills to set and monitor behavior goals, to avoid specific alcohol and drug use, to improve one or more protective health habits, and signed and dated with the instructor or others to make it a public contract, which increases significantly the motivation for that young person to change their habits. You can learn more about how Prevention Plus Wellness programs work by taking a look at our logic model and logic model components on our website at preventionpluswellness.com. Now let's take a look at Prevention Plus Wellness, how it addresses peer and desired future images a little bit more specifically, because this is really unique and core to Prevention Plus Wellness programs' effectiveness. So there is support for the efficacy of using positive images conceptually, research-wise and practice-wise. First, positive image in particular, but image overall, is supported conceptually through multiple health behavior theories, including possible selves theory and a number of other theories. Bandur's cognitive theory, for example, and others. Number two, image is supported by a whole array of research which indicates, and specific research in the areas of self-concept, prototype images, possible selves, and possible identity, which shows that, that youth health risks and behaviors are influenced by images, both positive as well as negative images. And lastly, there's been decades of practical application of using positive, appealing images in marketing and advertising from the largest, 500 companies to the smallest, small business companies. When they use marketing, when they use advertising, they're going to focus not on negative images. If they're going to use images, they're going to be positive. So you can take a look, for example, at the illustration to the right. This beer company is illustrating and highlighting the fun, the activities, good-looking young people socializing, happy, smiling in that social setting. And of course, are we having blank yet? It could be fun, or you could fill in the blank there, whatever you want, and the copy, the image of that particular product. And Prevention Plus Wellness programs are not selling a product, we're selling a lifestyle. So the positive images, I think, go very well with the promotion of positive outcomes associated with the wellness behaviors and avoiding substance use behavior. So rather than selling alcohol, tobacco, vaping, or any other clothing, cars, whatever you like, Prevention Plus Wellness content and images are focusing on giving young people an opportunity to think about their range of health behaviors, how risk behaviors interact with wellness behaviors, and giving them an opportunity to make changes. How does this happen? How do we do this? How does the behavior image model work in terms of constructing integrated multiple health behavior messages? Well, we've simplified it in just 2 steps. Step number 1, to present positive desired future and peer images and other benefits associated with a health enhancing behavior. Again, that could be aerobic exercise or sports or getting 8 hours of sleep. And then secondly, presenting how substance use or substance use behaviors, could be alcohol, opioids, vaping, marijuana, how those are barriers and interfere with that positive behavior and wellness image and represent instead feared images. The goal with this kind of communication is to trigger a mental picture of healthy behavior and how substance use is harmful. And we do this through vivid terms, vivid terminology or words, as well as illustrations. Now, let me give you an example of this. So the first step of this process, again, of constructing integrated multiple health behavior communications, is to first of all identify positive images and other benefits of a health enhancing behavior. So here's an example quote: young people who engage in regular physical activity, there's a specific behavior, a wellness behavior, tend to feel energetic, sleep better, and look more active, fit, and confident. So the image terms that cue or trigger images subconsciously in the mind of young people almost automatically and immediately are underlined: energetic, active, fit, confident. Very, very powerful and mental image producing terms, as well as other benefits like sleeping better. And now that's linked to physical activity. And then in fact, we show this illustration to the right of a young woman, a young lady who's practicing some or engaged in some aerobic exercise, specifically running. It looks like some cold weather. So we're trying to show young people, showing examples of them or images that they can relate to So we do want those pictures to represent both genders, different ethnicities, different types of positive wellness promoting behaviors. And then the second step to the messaging is to link how health risk behavior, specifically substance use, is a barrier to this wellness behavior and its positive outcomes. So, for example, quote, let me just move my image out of the way. So, marijuana use can, and you could use other substances in place of that, alcohol and so forth, can reduce your energy level needed to participate in regular exercise and achieve your fitness goals of being in shape, looking good, and feeling fit and active. So you're just showing, in this case, how marijuana interferes with that particular wellness behavior you just described and the benefits that come from it. Now let's talk about prevention plus wellness and how it promotes habits that improve mental and physical health. So this data is from the most recent Youth Risk Behavior Survey, 2017, high school national data. And as you can see, it's the percentage of every substance use, and the largest percentage of youth have ever used. In fact, 6 out of 10, more than 6 out of 10 have used sometime in their life alcohol. That's followed behind by vaping. 4 out of 10 have tried vaping. Over a third have tried marijuana. Almost a third have tried cigarettes, and 14% have tried opioids in their life. So we've got these risks, substance use risk, and there could be others that could be listed to that. A lot of other addictions, by the way, non-substance use addictions. But now let's take a look at chronic disease risk behaviors. Also, same data set, youth risk behavior data, high school, national data. And as you can see that these are the percentages of behavior. The majority of youth, almost 3 out of 4, are not getting 8 or more hours not getting 8 hours of sleep each day. Almost the same amount, almost 3 out of 4, are not getting the required physical activity 7 days a week. And then this is followed by almost over two-thirds are not eating breakfast 7 days a week. Over 1 out of 5 are watching 3 more hours of television, and very few youth are even eating 3 fruits and vegetables a day. So you can see these chronic disease risks, in addition to the substance use risks that the modern adolescents are exposed to. And these begin in childhood, and they go through, and they increase, these risks increase to young adolescents, increase to older adolescents, and then peak at our highest at young adulthood before they tailor off. But the risk has been done at that time. So in addition to sort of build on this notion of multiple risks among U.S. adolescents, there was a study actually done, a national study that showed back in 2010, showed over half of high school students are engaged in 2 or more concurrent or coexisting risks. That means that some high school adolescents have 3 risks, 4 risks, 5 risks. And these risks, again, are not just substance use, but chronic disease risks. And so these authors said that interventions at both the clinical and community levels, that include schools and so forth, should target multiple health behaviors, and that the interrelatedness of health risks should be addressed. And that's exactly what is done in prevention plus wellness programs, uniquely done, I would say. The only intervention, I believe, that does describe the interrelatedness of substance use risk, for example, and their influence on wellness behaviors. Here's another way to look at this. There are significant benefits of healthy lifestyles, meaning getting adequate sleep, eating nutritiously, getting regular physical activity. And the research shows that that healthy lifestyle is associated with improved physical and mental health and self-reported quality of life. Also, healthy lifestyle is associated with more positive self-image, self-esteem, self-regulation, self-confidence, and life skills. Especially relevant, I think, number 3 to all of us here in the substance use and mental health arena. Healthy lifestyle is associated with less depression and anxiety, unsafe sex, and less alcohol, tobacco, and illicit drug use. Also associated with greater brain development, cognitive functioning, more opportunity to socialize, have fun, make friends, greater academic success. Healthy lifestyle is associated with greater academic success. That's why these behaviors, nutrition, sleep, physical activity, so important to work and play, to school and work and play, including less suspensions, greater attendance, less dropouts, and greater attendance and completion of college. And lastly, healthy lifestyle is associated with less heart disease, diabetes, cancer, stroke, obesity, and osteoporosis. Those are chronic disease risks that develop over time. So we also found 2 reviews of research associated with multiple risk behavior program effectiveness. One review published in 2014 showed that integrated prevention programs are feasible and may be more effective than discrete interventions. In other words, programs that address multiple health risks or health behaviors may be more effective and more feasible, more practical than those that just address one thing at a time, one risk at a time, whether that be one substance use behavior or physical inactivity separate from so forth and so on. And then there was also a review in 2018, not too long ago, that showed universal school-based interventions that address multiple risk behaviors have a role to play in preventing tobacco, alcohol, illicit drug use, antisocial behavior, and improving physical activity. So there have been a number of important reviews of studies showing the benefits of multiple risk behavior interventions. Now, Prevention Plus Wellness Program implementation issues. Let's take a look specifically at implementation of Prevention Plus Wellness programs. As I had mentioned earlier, one of the unique aspects of Prevention Plus Wellness programs is that they are scripted, specifically word by word, and the pros in the left-hand column or the advantages are the ease of use of Prevention Plus Wellness programs. It lessens training time. In fact, we do training of implementers in just 2 hours of live training. Increases the fidelity and reliability of implementation across implementer time and setting, and it allows less skilled individuals to implement Prevention Plus Wellness programs. It could be youth leaders, which have implemented our programs. You don't have to have a doctorate, you don't have to have a master's degree, you don't have to have a particular kind of training to implement Prevention Plus Wellness programs because of their scripted nature. The cons, if there are any, are that it requires some practice, of course, because it is scripted. Number 2, some individuals have reported initially feeling unnatural because of the script until they practice it. And then it requires that you do have the script in hand, the manual in hand to provide your program. Now, let's talk about pre-implementation, implementation, and post-implementation steps for Prevention Plus Wellness programs, whether these are the evidence-based Sport and In Shape or the evidence-informed vaping, marijuana, opioid, Sport 2, or In God's Image programs. So the 3 steps for 3 pre-implementation steps are, first of all, to receive online or on-site training. This is highly recommended. It's not required, but it's very efficient and not very costly types of training to implement these programs. In fact, it's $200 and it's only 2 hours live to receive program implementer training online. Then you practice your protocols, your scripts to implement your Prevention Plus Wellness program individually with young people and in a group. using your PowerPoint slides. And then lastly, you make copies of your screening survey and screening survey addenda, your goal plan, your feedback survey, and your instructor survey, and you're ready to go. So if you're going to implement this to 20 young people next week, you make 20 copies of everything from your digital download, and you're ready for implementation. What are the steps for implementation? First, in a semi-private setting, particularly if you're going to implement this one-on-one because you're talking to one young person, an adolescent, a child, a young adult, about their particular health habits. So that should be, especially be in a semi-private or private setting. In that kind of a setting, you use the script to implement the screening survey and screening survey addenda. Then you show your PowerPoint slides, follow the script to present your feedback messages, again, either individually or in a group setting. You read and assist youth to complete the goals that are achievable for them in 1 week. You co-sign their goal plans or contract and ask the participants to post and monitor their goals. You administer a feedback survey, which is a post-test, and then you collect the screening survey addenda and feedback survey from each participant. And this data will help you see, which is so critical, how effective you are as a prevention specialist and how effective your program is. Prevention providers normally do not get that level, right down to your level of implementation, that kind of feedback, which is so critical and so important to understanding how you're doing, how well you're doing, what's working, and also to be able to promote your program and to improve it over time. And now there are a number of post-implementation steps. These include completing an instructor survey, which you do a self-assessment of your quality of your implementation. It's sort of it's a qualitative assessment. Secondly, to scan your participants' screening survey addenda and feedback survey in pairs. If you do that, you can, number 3, email it to us at Prevention Plus Wellness, and we'll run a free analysis of those data for you. A lot of organizations do this. Some of them do this at the end of the year, end of a semester. Some do it right after they get a good number of youth participants. Number 4, we suggest using the findings that you get from this evaluation to promote your program and to improve it. Number 5, you can use the fidelity checklist to ensure your program is being implemented with fidelity. If you want, you could follow up with participants. That could be immediately, or it could be a semester or a year later. And then you could maintain, or you should maintain, your 3-year certification if you have been trained as your program implementer or program trainer. Prevention Plus Wellness programs are implemented in all 50 states and in other nations. And because of they're just a single session for the most part, because they are positive in their content and behavioral focus, because they can be implemented individually and in a group, they have been implemented in just about any setting where young people are, including, and these are some examples for you to think about how you could implement a Prevention Plus Wellness program in your organization or your setting, or even your school or nation. During school, health, PE courses, classes, lunch, in lieu of suspension. So notice that our programs are being used for universal prevention as well as selective and indicated prevention. After school and community sports, recreations clubs, youth and family organizations like Boys and Girls Clubs and YMCAs, youth and peer leadership training and clubs. So we have trained youth to implement, to learn about, to receive, and then to turn around and implement this single session brief interventions to their same age or younger age peers. Hospitals and clinics, sports and school physical exam settings, faith-based organizations, juvenile justice homes, college campuses, dorms, and wellness events, counseling settings, and most recently, I think a unique application of the In-Shape Prevention Plus Wellness program in the military settings, particularly the U.S. Air Force. There's 2 options to consider when implementing Prevention Plus Wellness programs. The first option is, are you going to implement this as a standalone intervention or as an add-on or in addition to other prevention, health, sports, fitness, recreation, intervention, or treatment programs or activities? So the more it's integrated or the more that you provide, I think the better. And most organizations provide more than just our Prevention Plus Wellness program. They'll provide opportunities for physical activity or extra information or education about nutrition, or they'll provide other prevention or intervention programs. So it fits nicely because of its uniqueness and its ease of application to us, to just about any setting, and you have that option. Separate or to a certain extent added to or integrated with other programming and strategies. And then secondly, as mentioned before, you could implement a Prevention Plus Wellness program, most of them one-on-one or in a group, or both if you'd like. Follow-up becomes an issue, a question among our providers, and so you have your program, it's yours, your manual. You could re-administer the scripted screening and brief intervention every 6 to 12 months. We see that the effects do weaken over time, so you can, if you have access to your youth population or young adult population, you could re-implement your program, sport, in shape, vaping, whatever the case may be, Prevention Plus Wellness. You could also use our free online youth and teacher resources to extend and enhance your program efficacy. We've got a lot of content, free content on our website. Check it out under the More, M-O-R-E heading at preventionpluswellness.com. And plug in your email address also so you can get the free email blasts about new research and so on. So lots of good stuff. And during our program implementer training, we go over these resources. Number 3, you can implement follow-up parent flyers that are included with the sport program. Again, some organizations will send them out, hand them out, email them out, put them on their website, but it's a separate intervention that you could use to get parents to provide the same positive communication that you're providing to your youth. Number 4, you can meet with participants weekly to discuss, just focused on just discussing successes and emphasizing the goal setting, the self-regulation piece. Some organizations will do that. And lastly, you could implement additional lessons. So for example, if you implement sport or one of our other programs for adolescents, you could also implement the multi-session Sport 2 program that gives you 6 additional lessons. We emphasize the ease and encourage organizations to customize their program. It's very easy to customize to your setting and to your youth population by just altering your PowerPoint slide images. You can co-brand your slides, you can put your organizations or communities' colors. I'll give you an example of some changes here in just a minute. You could change the content slightly if there's a word here or there you don't like. If you want to expand some of the content on your slide, very easy to do. Co-branding, as I mentioned. Some organizations will do more of a cultural adaptation or a language translation. You're welcome to do that in collaboration with us. We can give you permission, and then you work with us to do that. The key thing is that you don't modify the fact that the underlying conceptual model is the behavior image model, the focus on these positive image communications, and that it is a screening and brief intervention. So if there's one major problem I have seen, or one key problem I've seen over the years of training others to implement Prevention Plus Wellness programs, it would probably be that some organizations will try to separate out the screening from the feedback and the goal setting. That's all meant to be done in a single setting. So that's the screening and brief intervention, one setting. There have been now we're on our 11th year. We're celebrating 10 full years of Prevention Plus Wellness program implementation, evaluation, promotion, learning about what we provide and seeing the effectiveness of it. And from this, we've had a number of things we've learned and made adaptations to the Prevention Plus Wellness screening and brief intervention model, including addressing emerging substance use behaviors and providing new content, specifically the development of our adaptations of our sport and in shape programs for vaping, marijuana, opioid use, In God's Image, and Sport 2 programs. In addition, organizations have implemented with some success, implementing our originally designed universal prevention interventions for high-risk kids as selected and indicated prevention programs. So, for example, identifying kids that have been maybe vaped in school, and then rather than suspending them, providing the vaping prevention plus wellness program or marijuana So kids that are high risk, that are either substance using or behavioral problems, or whatever the case may be, have, including juvenile justice, have been provided prevention plus wellness programs. Younger and older populations, originally the focus was on adolescents. Now we have programs for children as well as young and older adolescents as well as young adults. Some organizations even use our In Shape program for other older adult populations. Number 4, use of different settings. So over time, we've seen that our Prevention Plus Wellness programs can be implemented in any setting, wilderness setting, juvenile justice, any setting, including the U.S. military. Now, the U.S. Air Force has tailored some of the slides. So what they've done, as well as number 6, Mountain State, using sport, what they've done is they've changed out some of the images. So for example, in the U.S. military base, they've taken out some of the images, illustrations of young people, and put in pictures of some of their military personnel in uniform doing things, which makes sense. For the Mountain State, states that have used our programs, they've taken out some of the images, illustrations of organized sport and put in more mountain recreation activities like skiing, cross-country skiing, hiking, and those kinds of things. Perfectly legitimate and great ideas to customize. Also with the military settings, there was an addition of some extra, I think an extra slide or more content on one of the slides, which addressed, that wasn't in the original In Shape program, which addressed high caffeine beverages, which appeared to be, which were an issue and a problem on their basis. So that's how you can, and that's how we've found out over time some adaptations can, and these adaptations can make these programs more relevant and therefore possibly more effective. Also, follow-up strategies have developed over time, additional content, resources, flyers, and language translations like Turkish and Spanish. In fact, your sport program comes with parent flyers, lettered flyers in both English and Spanish. And then Prevention Plus Wellness program offers some very unique built-in pre-post evaluation tools. It includes a screening survey, addenda, that's the pre-test, and a feedback survey, that's the post-test. Both of these surveys are scannable. And you could scan them on any printer copier or dedicated scanner. They allow you to do almost an immediate pre-post assessment of your screening and brief intervention Prevention Plus Wellness program, and particularly on 4 critical measures that are predictive of health behaviors. We provide a free basic analysis of the scan surveys. You scan your surveys, you send them to us in a PDF. We've got the software, we'll run an analysis and send you what we're now calling a Youth Prevention Plus Wellness Behaviors Report Card. We also have an optional online pre-post survey for those of you that could use that, which could save you time. You don't even have to scan your surveys if you have your youth enter the data themselves. Now, the pre-post measures. There are measures, behavioral intentions, perhaps I don't think perhaps it is. I think it is the most correlated measure of future behavioral intentions. We have 4 measures of behavioral intentions on the pre-post test, assessing health behaviors and 5 substance use behaviors. Then social norms are assessed on 5 substance use behaviors, perceived harm susceptibility on 5 substance use behaviors, and self-efficacy to resist substance use on 5 substance use behaviors. All measures are on a 4-point, or the online survey actually has 5-point scales. And there are 2 critical qualitative items, open-ended items, which are essential for you to get the actual words of the participants, the youth themselves, to number 1, promote your program. What did they like best? And also to improve your program. What did they like least? And you will get that feedback from us if you send us your surveys. Now, conclusions, 4 very brief conclusions, but very critical to sort of summarize everything for you. Number 1, Prevention Plus Wellness programs include evidence-based sport and in-shape prevention plus wellness, as well as a number of evidence-informed adaptations addressing vaping, marijuana, opioids, faith-based, and the sport 2 additional lessons for adolescents. Number 2, numerous differences exist between typical substance use prevention programs and prevention plus wellness interventions, which really highlight the advantages of prevention plus wellness programs over most prevention programs. Thirdly, theory, research, and practice supports the use of brief as well as multiple health behavior, as well as brief multiple health behavior prevention plus wellness programs for preventing youth substance abuse and preventing wellness. And lastly, prevention plus wellness programs have been adapted to address emerging substance use behaviors, e-cigarettes, opioids, and marijuana in particular, levels of prevention, universal, selective, indicated, and other populations, settings, and languages. So go to our website and sign up for free prevention plus wellness resources, and also take a look at what we do provide online free at our website, preventionpluswellness.com. The homepage looks something like this. I think this is the most recent version of it. And in the right-hand lower part of your screen, you could click on that, message us if you have a question or comment. Left-hand screen, you could click on that and leave us your email to get updated resources. And if you do refer a friend to make any kind of a purchase, they'll get 10% off, and you'll once they make a purchase, they get 10% off, and you get $499 off, which means you get a free program or a couple of online trainings if you'd like. We are here to help at preventionpluswellness.com. Our telephone here in Jacksonville, Florida, 904-472-5022, or info@preventionpluswellness.com. So thank you so much for joining us for this presentation. Now, don't leave. I'm going to there we